Yeah, talofa everyone from Samoa. I hope you have all safely got to your places and all are successfully logged in to our discussion today. Before, as per our culture and our norm in our country, I would like to start us off with a short prayer, as I believe that will help everyone to be productive in their discussions and hopefully to guide us in our meeting today. So can we all from your respective places, I'll lead us with a prayer. Lord, we come before you as your humble servants in our respectful countries and in all our different places of work. We come before you, Lord, and we seek your guidance and your protection, and we seek your wisdom to guide us in this important forum. We are all humble servants, Lord, and you have called us in different areas, all for one purpose, and that is for the protection and over benefit of our country and our people. We ask, Lord, that you bless all our participants today and their families and their countries. In Jesus' name, amen. Okay, welcome everyone. First, I would like to start off with introducing myself. My name is Rexona Titi. I am currently working in the Attorney General's Office of Samoa. I'm currently the Assistant Attorney General, and I am the manager, or I lead the prosecution team in the Attorney General of Samoa. I have been in this role for a bit more than 10 years, but I'm glad to say that I am fortunate and privileged to have this opportunity to represent Samoa as to be the chair of our webinar discussion today. So I'd like to thank our PILON Secretariat for the opportunity, and also to the Attorney General for the opportunity and for trusting me in representing us today. So today's SGBV webinar is the final virtual activity for the PILON Week for this year, 2020. This webinar is a panel discussion, and we had invited 3 very experienced colleagues of our region to share their experiences, their knowledge, their best practice on the work that they do and continue to do on the increase in sexual and gender-based violence, and also to address some of the challenges and to share with us some of the solutions for services during the COVID-19 that we are in. Then next, I would like to welcome our panelists today again and thank them again for taking the time to speak with us today about the very worrying increase in sexual and gender-based violence during this year, and also some of the challenges and solutions for service during delivery during this COVID-19. Our first panelist is Ms. Marcia Kalinoe from the Family and Sexual Violence Action Committee, National Coordinator for PNG. Marcia graduated from the University of PNG in 2003 with a Bachelor of Science, Social Science, majoring in psychology and minoring in social work. In 2010, she also obtained a diploma in management from Divine Word University. Marcia has more than 10 years of leadership, management experience working in the space of gender-based violence. She has previous management experience with Anglicare BNG in providing counseling services and advocacy work and in facilitating training on counseling. She has also worked extensively with key population, particularly the women and girls affected by HIV and sexually transmitted infections. And she strongly believes in the role of empowering women and girls through education. Currently, as the National Coordinator for Family and Sexual Violence Action Committee, she's a lead agency in PNG for coordinating response and prevention strategies on ending violence against women and children. She works with a small dedicated team that strive to be epic in their work every day. Marcia is a staunch advocate on ending violence against women, children, and other vulnerable populations in PNG. Our second panelist is Ms. Stephanie Dunn from the Fiji's Women's Crisis Center. Stephanie is dedicated and passionate about working in an environment which promotes access to justice and works towards eliminating all forms of violence against women and girls. She is a proud feminist and activist. Stephanie was admitted to the Fiji bar in August 2013. In 2014, Stephanie joined the Legal Aid Commission and was with them for 3.5 years when she moved up to the rank of Senior Legal Officer before joining the Fiji's Women's Crisis Center in 2017. Since joining the Fiji Women's Crisis Center, Stephanie has been making a contribution on the fights towards elimination of all forms of violence against women and girls, as well as promoting equal rights and opportunities for women. Stephanie believes that everyone plays an important role in eradicating violence against women and girls, and we must all raise our voice in this fight. Our third panelist is Mr. Frank Fuaava from the Pacific Transnational Crime Coordination Center here in Apia. Frank Fuaava joined the Ministry of Customs and Revenue in Samoa as an investigating officer in 2018. Prior to this, Frank was in the Samoa Police Service for a period of 7 years. During this time, he worked in the general policing, prosecution, records, and the forensics. Mr. Fuaava is currently undertaking a 6-month secondment to the Pacific Transnational Crime Coordination Center in Apia. The PTCCC is part of the Pacific Transnational Crime Network, a multi-agency law enforcement approach to combating transnational crime in the Pacific. The PTCCC produces an annual assessment on behalf of the Pacific Transnational Crime Network on transnational crime in the region, and Mr. Fuaava will be speaking to some of the findings and recommendations from the most recent transnational crime assessment for the Pacific. We will now turn to Ms. Marcia, the National Director of the Family and Sexual Violence Action Committee in PNG, to hear about some of the experiences of our friends in PNG during the pandemic. Thank you, Marcia.
Okay, thank you. I'm just gonna talk to what has been given to me and what has been asked of me to talk around. So I'll just talk briefly on some policy development and legal reform measures that have, or calls that have come about when we had a recent death of a woman by the name of Janlyn Kennedy, and how it has affected the nation. And I'll just talk also on some advocacy and communication messages during COVID-19. So there is a growing recognition of the cost of GBV, or gender-based violence, family sexual violence on individuals and families, and that it is more physical than psychological, and there is an economic cost generally, and it is a barrier for citizens of Papua New Guinea to fulfill some of our directive goals and directive principles enshrined in our PNG Constitution. So according to the Human Rights Measurement Initiative of 2020 Pacific Report, PNG is the most dangerous place in the region for women and girls. And reports say 2 out of 3 women will have experienced some form of violence in a lifetime. After enduring roughly 6 days of torture on the 23rd of June, a young mother of 2 children, late Janlyn Kennedy's battered and bruised body was brought to the Accident and Emergency Unit of the Port Moresby General Hospital. And the head of department at the time, Dr. Sam Yakopua, took to Facebook to express his outrage and anguish upon seeing what had happened to this young woman. And it caused a nationwide outpouring of grief, protest, vigil, street marches, calling for tougher action and penalties for perpetrators of violence. But sadly, this is not the first death, and so many other deaths have gone unnoticed in PNG. So During this particular time, for the first time, our Prime Minister, Mr. James Marape, released a statement on ending violence against women. And he said, it's not a Melanesian or cultural thing. So don't use excuses. This is about character. And three things that came out at the time when we saw this uprising, this nationwide protest, a clear call for no compensation and mediation for DV, domestic violence, and a call to review laws and policies. There is even a talk about having a no-drop policy or a mandatory arrest of perpetrators. These are two things that became prominent at the time of late John Kennedy's death, and a call that's been voiced. And especially in this last week, so much has happened in Port Moresby. We've had the first ever National Summit on Gender-Based Violence. And this was organized by the governor for NCD. And we also are seeing that 20 parliamentarians have signed up and have taken a pledge to do something on addressing gender-based violence in PNG. So we've seen a growing interest from higher up, a political will to try to do something to address this. And we are hoping that more can happen, and it's not just people talking at a higher level. Systematic change to occur requires investment, and it has been voiced already that GBV is costing more lives and more loss of lives than COVID-19 is in PNG. And if the government can put a lot towards COVID-19, then why not towards GBV? So these are some reactions that are coming from the public. I will now move on to talk about some advocacy and communication messages during COVID-19. So from experience, when there is a disaster of some sort, we see an escalation of violence. And just like the rest of the world, we see violence against women has spiked in PNG due to COVID, due to lockdown measures that have come into effect because of COVID. In 13th of March, we saw our first case of COVID-19, which led to a 14-day lockdown and a state of emergency declaration. And the first community transmission was detected on the 6th of April, which saw a further extension of 2 months state of emergency. And we had another lockdown in August. So basically, there's been this has caused disruption to a lot of services, including services for gender-based violence, family and sexual violence. We've also looked at measures where we can frame some of our response plans to be gender-centered and frontline workers of gender-based violence to be considered as essential workers and to be supported as well in terms of having access to PPEs and to be supported to be able to do their work. Access to services is a big issue at this time, and upholding human rights, stigma and discrimination of workers or families who are affected by COVID-19. So some of the impacts that we saw, services were affected, safe houses were closed, but we saw that where there was operational support to keep services open, it made a big difference. For example, when courts were closed, people couldn't get protection orders. This was some real challenges that were faced at the time during the lockdown. We saw toll-free numbers became very relevant. There was a big demand to get the messaging out there that you can still call in for help and you can still get messages. So advocacy and communication messages went out, also calling for more community and community leadership in the space of addressing GBV and looking out for each other. Services have to adjust themselves as well to having COVID-19 measures in place. And so, for example, safe houses were one of those. It also brought to light the gaps that survivors faced and in the referral pathways. And so it took a lot of communication on our part with service providers on how best we can support. When we link this back to the case of late Janlyn Kennedy, she was someone who came to a safe house in April. By May, she made her way out, and then by June, she had passed on. So it definitely had devastating consequences for a lot of people at this time, a lot of survivors, and we still are looking at ways that we can improve. But we see that communication is a big component of addressing these issues. Thank you.
Thank you, Marcia, for that very interesting and compelling story from PNG. I invite the audience to submit questions through the chat facility, and we will welcome them at the end of the next two presenters. We will now go to Stephanie Dunn, a lawyer with the Fiji Women's Crisis Center, who will be talking about the front line of the fight against violence against women in Fiji during the pandemic. Thank you, Stephanie.
Okay, with Fiji, we had our first case on March 19, 2020. So even prior to that, the women's movement, specifically Fiji Women's Crisis Center and our coordinator, they started to foresee what might happen considering what had happened internationally. When curfews, restrictions were put into place, we noticed that now more and more women were now trapped with the perpetrators in their homes. So the good thing about Fiji is that our coordinator had called up our Minister for Women. We have a very good minister, and they started to put into action to create groups. So out of the cluster, there was government agencies as well as other service providers that deal with GBV came together to create a GBV COVID-19 working group. And from this group, they started to make sort of like referral pathways, what could be done in curfews, who can be declared essential workers, because prior, just like Marcia and them, GBV service providers were not declared as essential workers. So that was one of the requests, because if domestic violence survivors were going to call, obviously we can't say, I'm sorry, you'd have to wait until curfew was lifted, then we'd be able to assist. And that was putting the survivor more into danger. So one of the things we did do is they did declare some of the staff from each of the service providers as essential workers, so it would make them easier to get the survivors out when the need, when there was a need. The other thing is for Fiji, we have a national government helpline, and it's 1560. So with this line, it's toll free. They can call from any number, whether it's a mobile, from any network, or from a landline, and it's 24 hours and 7 days a week. Even part of Fiji Women's Crisis Center, part and parcel of our preparation for COVID-19, understanding the new threats that were going to come in terms of this virus, because for most of us, we're prepared for national disasters. Fiji has gone through 4 coups already, so we were also prepared how to deal with that. But COVID-19 was a new virus, and in itself, you also have to protect the staff as well as ensure that there was no further harm done to the survivor in them also getting the COVID-19. So we had a lot of PPEs available as well. So one of the things we did see is working together, collaborating with all the service providers, made it a bit easier. There were still hiccups down the line, don't get me wrong, there were still hiccups down the line. But one of the things that we did notice is, with survivors that were calling in, they told us that there was an increase in escalation of violence. There was more coercive control, because now that they were trapped with the perpetrators, their phones were constantly checked. They were asked who they were talking to. And even there were some cases where women were in the lockdown and there were risks to them getting the COVID-19 virus. The men would stay at home and wouldn't put themselves at risk, but would send the women out to do the shopping. And on top of that, because they were still trying to monitor their wives' movements, they would send the children with the wife. So that when they do come back, the husband will be able to ask, where did your mother go? Who did she speak to? And one thing we also noticed, there were certain areas in Fiji that were on lockdown, not the whole country, just certain areas where the first case we had received in Lautoka and the places he had gone to, only those areas were in lockdown. But what we saw is that the drivers that were calling in, the perpetrators were using the lockdown in that area to say or suggest that it's all over Fiji, which means you can't leave the home, your families can't come and see us, and you can't go to work. So there was a lot of restrictions put on our women. There was even some survivors that had also come out to say that while they had to work, especially those that were first responders, that they had to go out, they work long hours, come back, and still some of their husbands would demand. We had a survivor where the husband demanded for sex, and if she did not, she would be kicked out of the house. You had survivors that were saying that, you know, there was an increase in demand for sex because now he was home, he couldn't leave the home, and if it wasn't, there was a lot of emotional blackmail. There was threats to say that you will no longer be allowed to stay in the home. There was even threats to say that if you don't sleep with me, then the children will be put outside. So these were the calls that we were getting in. And just like most countries, and like what Marcia had already pointed out, because of the restrictions and because we had to close our borders as well, it affected most of our sectors, and one of which is tourism industry, also our informal sectors. And predominantly, these are the sectors where women are employed. So obviously, most of them were laid off. That created more burdens on the family. Usually before we used to see rural-urban drifts. Now we're seeing more urban to rural drifts because families can no longer cater for, you know, their needs in the city. So what they do, because they've lost their job, they move back to their villages, they move back to their family homes. What happens with that is that from that nuclear family, it now goes into an extended family. So whatever resources that they have, they now create a burden there. And as we know, most homes, it would be the woman getting up, preparing the home, preparing the breakfast, trying to look after the family. It put more burden on the caregivers of that home, on the women of that home. We had a few callers calling in to suggest and say that, you know, it was really stressful because now, before they had to look for their own family, now they have to not only prepare the food, but also ensure that their needs and the needs of the families is catered. Their health, their needs were put on the back burner. And, you know, it also correlated with, you know, in October when we were talking about breast cancer, and most people were saying, please come in, get checked. But the reality is most women put their health on the back burner for the families. And that's one of the things we also saw come out here. And just like with economic downturn, a lot of pressure also came onto the families. They weren't able to meet their needs, even a bit difficult, you know, the new normal where you had to learn from home. It was very difficult for some families because even before you can ask for data and computer and learning online, one of the difficulties, first of all, is whether they have electricity, whether they have access to a computer, whether it was easy for them to ride in a bus here. A lot of people were saying that, oh, catch a taxi, but the issue was cost. Who would pay it? How would, you know, who would support them then? So these are a few of the things that we had also seen. And, you know, one of the things that did come out of this was the collaboration between all the GBV service providers. It made it easier for the survivors to access the service and a referral pathway so that everyone knew where they were going, who they could refer to. And because our domestic violence legislation allows for DVR or protection orders to be given over the phone, it also eased the process as well for those that were wanting protection orders. But I think one of the difficulties we did face, especially with survivors, was access to justice. So while you could get protection orders, maintenance orders were seized. So it created more financial burden for single households, especially those where maintenance was one of their main income earners. So we had to provide food packs for survivors, because at the end of the day, while we're also looking at the emotional well-being, seeing that they're okay, we also need to make sure that their needs are met. So one of the things we also saw is because a lot of finance was starting to get a bit tight, they start to cut down on a few things, which means the elderly or the widowed, medication was not a priority anymore. So they would have to choose between feeding the family or actually paying for medication. So that's also one of the things that we did also provide, just to at least not only ease the burden, but ensure that women also look after their health and they get the medication when they need it, not when it gets too late and there's more health precaution, complications, sorry. So that's one of the few things. And like I said, with the new normal, it was a bit difficult. Women were saying it's hard to access the services because you had the perpetrators around them. So they would call and just like, oh, okay, yes, thank you. Thank you. All right, okay. Then we'd have to, our counselors would just, the antennas go up and say, okay, is the perpetrator there? There's like, okay, yes, I'll call you later. So it was a bit difficult for some of them while being locked in their homes with the perpetrator to access services when they needed them. So what we found is after the lockdowns, then we had a spike in calls, and that's when we started to find out all these things were coming out from the survivors. And it's even more difficult when you have issues with finances, traveling to try and access the services. And when you do get there, and then service providers that are mandated to assist are not helping. So while they're mandated to provide, let's say, for example, legal services, their office is closed and they're asking you to apply online. What they're failing to realize is the most vulnerable usually do not have access to these services. They don't have access to computers. They don't have access to data, even if they do have phones. So how are they going to be in a position to make an application for the service online? So I think those are one of the things we did find. We also found that perpetrators were using, they started to get more cyber savvy. They would create fake accounts. Harassment then moved from on the streets to online. So we saw a spike as well in terms of cyberbullying. Just a few days ago, we have seen a couple of videos that have been shared, and one of the videos involved an year 8 student. So these are the things that we still continue to get in. And one of the things that we have found is it's important that all service providers that are dealing with gender-based violence be on the same page. Otherwise, the way that they respond during this time will not be actually good for the survivors. It'll do more damage to them. It's very important that they understand what is the root cause of gender-based violence, because when you do understand, you'll know how to tackle the issue. And like we always say, the root cause of gender-based violence is patriarchy. It's the ideals that men rule, that men decide, and that a woman does not have autonomy over her own body. She's unable to make decisions on her own. So we need to get rid of that sort of mindsets to ensure that at least there's something done for our survivors. Otherwise, this issue will continue. So these are just a few of the things that we've noticed with survivors. We've also even seen some cases for child abuse, and where we've even had survivors and police officers assisting with getting them out and taking them for shelter. So even that was one of the biggest difficulties as well, was shelter. Because one of the things that we were told is if the COVID-19 does persist and we have more cases, then it will be a bit more difficult to cater for people in the shelter. There's a risk of the shelter closing down. So the good thing about Fiji is our shelters are still open. They still continue to assist. And FWCC actually had a backup plan for that. So that was also good. So thank you so much. And I'll be open to questions if anyone has any.
Well, Stephanie's experience and passion for this subject matter have given, I'm sure, a lot of us food for thoughts, and I'm sure a number of you will have questions you would like to ask Stephanie. So thank you, Stephanie. I would now like to invite Frank Fuaava from the Pacific Transnational Crime Coordination to take the floor to provide us with an update of the latest transnational crime threat assessment for the Pacific.
Okay, talo falava, and once again, my name is Frank Fuaava. I'm a member from Ministry of Samoan Customs and Revenue, and I am currently secondary to the PTCCC for the Pacific Transnational Crimes Coordination Center based here in PIA. Today I'm going to speak to you for about 15 minutes on two things. Firstly, I will speak to you about a brief overview of Transnational Crime Network, or PTCN, and secondly, child exploitations in the Pacific from a report done by the PTCN, being the Transnational Crimes Assessment for the period of 2019 to 2020. Just before I start, for your information, I am not a subject matter expert on child expectations, but we're only speaking to you about the findings from the PTCN report. Next slide, please. Thanks. Just a quick overview on the PTCN and who are we and what do we do. So the PTCN is operating since 2002 as a Pacific Islands Chiefs of Police program, and PTCN comprises of the PTCN Secretariat based in Canberra, Transnational Crimes Unit or TCU based in 20 countries of the Pacific, and PTCCC, where I seconded now, based here in PIA. So the the PTCN is a well-established and trusted law enforcement information sharing network operating on declarations of partnership between law enforcement agencies, and also noting that multi-agencies collaborations is a key to effectively combating, transnational crimes in the Pacific. So the PTCCC is staffed by members of law enforcement agencies across the Pacific, and they perform four main roles. Firstly, the coordinations of information across the network. Secondly, productions of intelligence report. As of today, I'm going to speak to you later on one of crime type that will cover in the TCA or the intelligence report. Thirdly, the regional collaborations, and lastly, fourthly, capability building. Next slide, please. Yeah, as you can see that the PTCN is a, as I said before, it's a multi-agencies approach combating, transnational crimes in the Pacific. And as you can see, the slide in front of you, the PTCCC or the Pacific Transnational Crime Center is in the center, and all the TCUs are feeding all the information into the PTCCC. And TCU as well is comprising, a multi-agencies, police, customs, immigrations, financial intelligence units, and etc. Other law enforcement agencies as well. Next slide, please. Yes, as you can see on the screen, there are 28 TCUs based in 20 countries of the Pacific. So those flags on the screen represent those countries with TCU. And if you ask me why there are 28 TCUs in 20 countries, and that is because such countries of the Pacific, such as PNG, Vanuatu, Fiji, and Solomon Islands, have multiple TCUs. So there are more than one TCU that makes up 28 TCUs in the countries, and we were working collaboratively with all TCUs to keep, the information flow. Next slide. Yes, just a brief background on TCA, what it is, and why we, why the PTCN provide this intelligence, product. So the background, the PTCN TCA or Transnational Crime Assessment is an annual report that being produced by the PTCCC on behalf of the PTCN and member countries or TCUs, as I said before, and it is created to inform the Pacific law enforcement community on current, transnational crimes issues impacting on the Pacific, and to provide intelligence informed assessment of emerging transnational trends in the Pacific. In terms of methodology, this assessment has been produced from information exchange of the PTCN for the period of 1st of July last year, 2019, to the 30th of this year, 2020. So this information exchange include information that are being received from the Transnational Crimes Unit or TCUs, open source partners agencies, and they all are coordinated through the PTCCC. So there are 8 transnational crimes. Next slide, please. Sorry. Yeah. So there are 8 transnational crimes covered in the TCA or the intelligence report, but we only speak to you, as I said before, we only speak to you on child exploitations piece of the report. So when speaking about child exploitations today, I am referring specifically to, firstly, online exploitations of Pacific children as victims, inclusively accessing in the Pacific of online child exploitations materials, such as sexually, explicit material, and traveling of registered child sex offenders into and through the Pacific, and lastly, the child sex tourism in the Pacific. So the overall reporting on child, exploitation is currently limited and largely anecdotal across the PTCN, and it's still an intelligence gap. So in regards to child exploitations in some countries, the nature and structures of a village would enhance detections and or prevent, the offense against students by visitors and in the online space. Just for example, in Samoa, the Matai systems also provide a detections and deterrence, elements for the outsiders. But however, the more, more smaller remote communities are likely to be more vulnerable to the lack of awareness and modus operandi of child sex offenders, and especially in grooming both the victims and their families. So grooming can occur in persons or online over a period of time, and includes offering gifts or financial support to the victims and their families, and enable offenders to be left in the positions that beyond or left in positions of trust with the victims or a child. So in regards to online child exploitations, there has been no reporting through this reporting period of online child exploitations victims in the Pacific that have been received by PTCN, and limited reporting, of accessing online child exploitation material. However, it is likely that the increase of accessibility to the internet will result in an increase on this topic. Online offending can include, live streaming on offenses committed against a child, and sharing of a child exploitations material, and increase of technology development and connectivities in the region is likely to produce an increase in the excess of child exploitation material, and possibly an emergence of online exploitations on child victims in the Pacific. But to date, there have been no reports received by PTCN of live streaming, victims in the Pacific. So in regards to registered child sex offender traveling to the Pacific, they present, a safety risk to our communities. And although the purpose for their traveling may be legitimate, such as holiday, business staff, or visiting their families, but it still presents the opportunities for them to reoffend, especially if there is no management on them upon arrival. So the movement of child sex offenders can indicative, of child sex tourism. However, there is limited information on child sex tourism in the Pacific. So PTCCC, we received, travel alert notifications for registered child sex offenders traveling to the Pacific and through the Pacific, and are being received from Australia, New Zealand, and United States, or via Interpol if they are coming from other countries. And these are being forwarded to destinations countries, TCUs. As I said before, this is how we working collaborated with those countries and other countries. And this is a similar process that are being used for outlaw motorcycle gangs members are being traveling into the Pacific. So the Pacific may have the Pacific Island countries may have irrelevant, legislations to prevent child sex offenders from entering their shores or their beautiful countries on the ground of character and references. As a result of COVID-19 pandemic in regards to child sex offender, so the pandemic has limited, the ability of registered child sex offender to travel across the Pacific. And however, as borders reopen, they will likely to be travel again. We do have reports in regards to cybercrime. As you can see on the screen, there are 8, transnational crime types that have been covered. One of them are cybercrime. So there is a lot of online activities. As I said, cybercrime are being reported through this period have been increased from previous years in relation to cyberbullying, scam, phishing, ransomware, and spreading of misinformation. And individually being targeted through social media platform, and the offenders are targeting our shores, our island at the time. But yes, we have seen, a lot of report, it relates to cybercrimes are been increasing in relation to that what I said before. But there are no reporting on on children as victims in the Pacific, and there's limited information and limited reporting in regards to accessing, online child exploitations in the Pacific. Next slide. Yeah, we come to our final year, and that's my final slide for today. It is law enforcement, opportunities or effort to combat the child exploitations in the Pacific. So the PTCN are increasing their focus on child exploitations, and this include, as you can see, firstly aiming to increase reporting and awareness in this space, information sharing in regards to traveling of child sex offenders, increase partnership with non-government organizations working in the field of child sex exploitations, and increase awareness throughout the Pacific, and encourage reporting to law enforcement of child exploitation, seeking to establish relationship with international partners and propose a coordination point for such informations. And lastly, the additional support to be provided to the Pacific law enforcement agencies to investigate online child exploitations. But of course, law enforcement effort, all we need to be supported by the Pacific Island countries is having the appropriate legislation to enable the prosecutions should online child exploitations offenses be detected. So yes, next slide. Oh yeah, thank you very much for the opportunity to be on the panel today. Patalava.
Thank you, Frank, for that very comprehensive overview of the situation here in our Pacific. The increase in online activity certainly throws us some very challenging situations in our region. I again would like to thank all three of our panelists for very comprehensive and thought-provoking presentations from your experiences and sharing what is currently happening in your countries, especially from our passionate advocates, Marcia and Stephanie. So thank you again. I will now turn to questions and comments from the floor. So her question is, she's interested to know how different jurisdictions are approaching behavior change of perpetrators, particularly in the context of convictions and sentencing of perpetrators of domestic violence. So her question is, how do different jurisdictions approach the issue of rehabilitation of offenders? Are there, for example, diversion programs that the courts can direct the offenders to?
Hi, Secretary. This is just Stephanie. So in regards to Fiji, we do have perpetrator programs. Unfortunately, they do not live up to international standards. We don't know whether they actually focus on changing mindsets and seeing whether there is change after conviction. One of the things that we have noticed is there's a lot of Bible thumping. So you go in and you just continue to, their way of changing a convicted perpetrator is what we'd call Bible thumping, going in and using religion to say that they have made a change and now they're going to go home, they're a new person, they'll never do this again. But see, one of the things we've seen is that offenders are then using that program to say, we are now no longer sinners, we have changed, we are going to go out, we'll never touch our wives again, or we'll never sexually abuse anybody. And that's one of the difficulties there, you know, because they don't have standards in place, and most, you know, rehabilitation programs don't really live up to the international best standards. And because they don't, we don't see a lot of, what can I say, success with the perpetrators that do come out of these programs. And most of the focus we found is that they're more focused on the perpetrator and trying to change his spiritual side rather than what caused the violence in the first place. And remember, in Fiji, we have the Yellow Ribbon program, which we still say that there's a lot of gaps in there.
Oh, thank you, Stephanie. It's very interesting to, quite interesting to listen to your answer, because it's quite a very similar situation. I think it's perhaps it's a common thing in our Pacific, always using the Bible as a getaway. And when, just for an example, when we do have judges who are very religious, they tend to really take that on board. Which is a bit difficult for the prosecution or for us advocating for the victims, because then it takes the focus out of the cause or the root of the offending and tends to deviate the court from addressing the issue. It's a similar issue that we face. So thank you very much for that. So our next question that's been forwarded is, the question is on the whistleblower protection. Do you see a scope for whistleblower protection regimes to be applied to the sorts of wrongdoing which we are considering today?
Hi again, I'm sorry. I'm not too sure what the regimes are in place. Maybe if we did, we'd be in a better position to answer it. So I think it's a bit difficult because we weren't really part of the 2017 PILON whistleblowing protection thing. So maybe if there's a bit of background in terms of what regimes you have in place, then maybe I'd see whether it can be applied in this situation.
Our next question is from Dave of the Pacific Islands Chiefs of Police Secretariat. The question is specifically for Marcia and Stephanie. If there was one thing that the Pacific Police could do better to address SGBV, what would it be?
Okay, let me try. I think from PNG, we say sensitizing the whole police force. It's a way forward. One thing about the trainings that police officers go through it's 6 months of training to become a police officer in Papua New Guinea. And we say 6 months is not enough. It needs to be longer than that. At least there's enough information given to them. In education is a big part of trainings, and people need to be equipped with enough information on the laws and to be able to prosecute. The reality for PNG, we have very good laws. We have very good policies. It's the implementation, it's the prosecutions. That's a challenge.
Thank you, Marcia. I actually agree with her as well. One of the difficulties that we found, it's the way that these, because remember, it's very difficult for survivors to actually approach service providers to get the help that they need. And usually the first people that they get in contact with is the police. And if their response is not sensitive, and if their response is not done appropriately, then obviously survivors will not come again and approach the police. So first and foremost, sensitive training must be done, but it's also important that not just 1 hour or 2 hours given, because we do a bit of training here with our police academy, but what we've noticed is for gender training, they've only given us like 2.5 hours, and that is not enough for the police to grasp what gender is and what does gender-based violence mean. So not only do they need to have it in the beginning, but it also must have refresher courses along the line. So even for those where they're going for corporal, when they are moving up the ranks and they're getting their promotional exams where they need to test, this should also be part and parcel of their training. Because currently what FWCC is doing is we are also doing training with the police. So the first thing they need to do at least is the trainings, raising awareness on what gender is, what gender-based violence is. And before they can raise awareness, they themselves need to understand what it is. The second is the police also need to know the laws that are in place. Because one of the difficulties that I did find, especially with our police force, and I think Marcia might also have similar experiences, because like she said, it's the implementation bit. They don't know what the law says, what are the limits of the laws, and what they can do. And that's difficult because when you then take it down to prosecute, you'll see that there's a lot of gaps in between that has happened. They don't know how to give the right to remain silent. Say, for example, in Fiji, there's a lot of unnecessary force used in between, not sufficient breaks. And this all comes down to whether that confession that they have obtained can be prosecuted. So it creates that prosecution nightmare for the prosecutors. So that's why it's important, if the police know how to gather information, the relevant information that is needed to prove the charge that they're going to lay, it makes it much easier. And it's also a smoother system for the survivors. And one of the things I see, they need to understand gender. Why? Because sometimes survivors will come, then they'll say, I don't want to charge, but can you warn the perpetrator? And there's a reason behind it. Because for her, we've always been put in our minds, especially for those of us that are married, that wives, you need to submit. So for them, they don't want to say, no, we don't want our marriage to destroy, but please, can you warn him? And they go back and forth. There's a lot of back and forth. And what happens is, the police don't realize, but their biasness affects the way that they treat the survivors, how they respond. Even sometimes they even tell them, oh, it's just her again, just tell her to go. And we don't know, maybe that will be the last time that you'll see her. So that's one of the things is, since they need to be sensitized, they need to understand what it means, and they need to respond appropriately. And I think even AFP and FWCC have done a lot of these trainings with not only police here in Fiji, but also around the Pacific. And I think even Frank might be able to give a bit input if he wants to as well.
Thank you again, Stephanie, for that. We'll move on to our next question, please. Question from Jennifer Hyatt from Australia. She would be interested to hear more about the process and effectiveness of getting family protection orders by phone that Stephanie had mentioned. Was this used before the COVID restrictions as well?
Hi, thank you again, Jennifer, for the question. And yes, under our Domestic Violence Act, it does allow for the police, and it's only a power given to the police to make that application over the phone. No other institutions or organizations can, just the police. And what they can do is they can fill the forms out and fax it. Unfortunately, the legislation only allows for fax, but if they can't fax because maybe there's issues with the line, and like for most Pacific Island countries, we have outer islands, and trust me, network is an issue, electricity is another issue. So not all the time the fax will be working. So they've allowed that you, over the phone, you can let the court know, actually the judicial officer, that this is the application made, what has happened recently, what has happened in the past, and the reasons why the court should give the protection orders in order to protect the survivor in the future. So once all of that is given, the judge then makes a decision, and the magistrate, and then gives the order back over the phone. So this was done even before COVID, and it was quite handy even during COVID and when there were restrictions in place.
Thank you again, Stephanie. This next question is for Stephanie, please. Has Fiji now refined its categorization of SGBV workers as essential workers based on recent experience?
Unfortunately, no. So what we had done is, because of the group that we had that was made to combat GBV during COVID-19, they had certain workers from the service providers, employees, certain staff from certain service providers were given that special provision just during this period. Unfortunately, the definition of essential workers still remain the same. I think it was just the special provision given to us during this time. And also one thing we also have to be thankful is, for police, they have a command center, which is for all the different divisions, and which you can always call just to allow you to go through the checkpoints. Because right now we still have curfew from 11 till 4 a.m. So if you want to travel outside the time, you can still liaise with the police through their command center.
Thank you, Stephanie. Our next question is, has there been any programs that address the use of digital technology to assist with victims of the domestic violence in helping provide evidence-based data on incidents and episodes?
Yeah, just a short answer, I guess. There's a safety, child safety Pacifica, they can provide, safety awareness in regards to those aspects on domestic and, on child abuse.
Thank you, Frank. We'll move on to our other question from Mr. Ronald Talasasa. A question for Marcia, please. He quotes, I quote Ronald, "Your Prime Minister expressed it well. It is not Melanesian, neither cultural. It is character. As you have mentioned that the killing of the young woman was not the first, what do you see the future in the Pacific is the aggressive way in combating such violence? Is there hope at all for a way forward?"
One thing that we say is from PNG is that it's everyone's responsibility. It's everyone's responsibility to address issues of family and sexual violence, gender-based violence, domestic violence. And we see that I will just speak for what's happening in PNG. We see that the law and justice sector have taken note of the lack of or the failure to prosecute well on convict FSV cases. And so there is a push to look at what is the issue and what needs to be done about it. We also need political will in looking at this. And so just this week, we now have a parliamentary committee looking at GBV, which has just been established in Parliament. We've never had such in the past, and this is the first time ever for the country. And so seeing that it's now taken to another level, we're hoping that this really prioritizes and draws on the need for more support, mobilizing of resources to address this issue. It also means strong training programs, education programs, sensitizing programs to respond. And also looking at programs that not just basically about awareness, but they go deeper and they lead to addressing change. How can transformative change happen? How can systematic change happen? These are important areas that need to be legislated, need to be supported, need to be mainstreamed. And these are mainstreamed across all sectors, not just in one particular area, but right across, from education programs in schools, right across to workplace programs, church programs, in all sectors and space and spheres where we do this work, in communities as well. And that's basically what we see, that everybody needs to play their part in addressing this issue.
Thank you, Marcia. Now we on to our last question. This question is for Frank, please. It is encouraging to see efforts to increase reporting and awareness. How is this being done?
Thank you, Howard, for your questions beyond how is awareness and increased reporting being done. So the PTCN is looking to raise awareness of online child exploitations through messaging within our network, and increase partnership and encourage, sharing of information within the network.
Thank you, Frank. Okay, I want to thank all my colleagues from around the Pacific joining in our discussion today. We hope you had benefited from the discussion and welcome you to participate in future PILON events. It is a strange new world we have emerged into this year, 2020, but the opportunities for online engagement and learning are tremendous, and PILON will be holding further online sessions on all three of these strategic priorities: the cybercrime, corruption, and sexual and gender-based violence throughout this year and early next year, 2021. Please keep an eye out for information on these sessions on the PILON Facebook page and website. I encourage you all to participate and make the most of this opportunity to learn and come together online to improve the way we respond to violence against women and girls in our Pacific region. Please also visit our PILON website to access resources developed by the PILON legal community for the Pacific, including our recently launched model provisions with explanatory text on special measures for vulnerable witnesses in sexual assault trials, and the PILON guidelines for our support to vulnerable witnesses. So thank you all again, and we hope to see you again in our next session.